Dr. Luis Tello.
Hello.
Welcome to Animal Economics.
Thank you
Thank you
so
for
much.
coming.
Very
Thank,
happy to have you here. Thank you so much for having me.
yes, thank you, Doctor. Doctor, what should we pay attention to during emergency intervention and brachycephalic dogs? Brachycephalic dogs. What do you think about?
I mean, emergency is a little different than the rest of the medicine. It's a very emotional situation. There's a lot of things going on at the same time. While there's a lot of things going on with the patient, there's a lot of things going on with the family too.
Yeah.
Particularly where I work in, and I'm talking about Americas, and that includes Canada and United States. The cost of care has also been rising a lot lately. So the economy factor has been a very important factor for decisions to a big part of the population cannot afford that type of care. So uh, unfortunately, euthanasias are in the air now because, again,
Okay.
the cost of many of those type of medical cares are very high. So because emotions, care,
Okay.
the majority of those situations are unexpected. Um, there's a lot of things going on at the same time. For the
Yeah.
medical team, it's also, uh, I could say, a very challenging situation. A lot of time there's a lot of emotions coming out, sadness.
Sad.
Nobody expects your pet to be hit by cars, poisonous, attacked by another large dog in the park. So there's a lot of anger, emotions coming at the same time. Nobody want to talk about money, and money is in the air. Nobody want to
No.
hear that there's a possibility of your dog dying. So for younger, you know, professionals, that type of conversation is a very tough call, and that is I don't know if the situation in Turkey in particular, but I travel a lot. I visit a lot of countries in the world, and the younger population of professionals, it's a type of conversation they don't feel comfortable talking. They don't feel okay discussing this type of conversations because it's emotional, it's tough, it's not easy.
Yes.
And that area of the profession, a lot of younger doctors don't want to be there because that they like the medical part, but unfortunately, you have to talk about that. You have to have difficult conversations and sometimes difficult decisions. So it's not an easy. It's very challenging.
Yeah.
There's a lot of very nice medical parts. I always say I don't think there is any more beautiful thing that return a pet to a family when they think the pet is gonna die, and you say, nope, here is your pet back. It's okay. You can take it home. There's very few emotions that you can feel much beautiful than that. But a lot of times the situation is not like that, and younger professionals they don't want to deal with that very often now.
Okay. Is it more challenging to perform emergency producers on obese patients?
Yes and no. There's
Why?
certain type of emergencies that are more complicated in obese pets. Uh, the classic thing, I don't know if in Turkey there's certain breeds who are in fashion. In a state, in Europe, in Australia, these flat-faced dogs, Frenchies,
Yes, yes.
boxers, pugs, who are beautiful. They are really nice puppies. So
Yeah,
they're
yeah.
adorable, but they come up with a lot of genetic problems, respiratory problems, and they come up with a lot of other issues. If you add obesity to that, respiratory insufficiency is common in the ER, and many of them is the last visit. And
Yeah.
obesity play a very important role on those dogs
Those.
because they develop respiratory insufficiency, cardiac disease associated with that, and a lot of times there's not much you can do about it. And unfortunately, people don't want to see that. They like the puppies because they're really nice dogs. They're playful, very joyful. They're really nice, but they come up with those problems for
Yeah.
all their life, and the ER visit is the last one, and you have to talk about it.
In case of multiple trauma, what's the first and most important point to focus on?
That's a
It's a
difficult
big,
talk
big
about
problem.
it. I could say you need to talk with the client, and I could say that is the more important thing. You need to discuss with the client and have a clear idea what the expectations are. You need to sit with them, like in human multiple trauma, you are dealing with a very complicated case, and the client needs to have very clear, realistic expectations of what's going to happen.
Yeah.
This is not a case that you're going to give few pills, few drops, a few of that, and everything's going to be fine. That's not the case. When we deal with multiple trauma, think about it. It's a dog who most of the time weighs 10 kilos and is hit by a car who weighed 500 kilos and he came at 50 miles per hour.
More different.
The amount of damage that that type of trauma produces in a small dog is severe.
Yeah.
So the amount of care that that requires is exactly what happened in humans in a very severe thing. So we're talking about transfusion, fluid therapy, a lot of hospitalization, medications, care, pain care.
Yeah, pain
So
care.
if the client expects this to be simple, fast, and cheap, that's not going to happen.
That's-
So a shower of reality is something that needs to happen.
yeah. Well, last question. Could you share your thoughts on the KLIVET Congress? What do you think, man?
I love it. I love it. I mean,
You love Turkey.
I've been here multiple times. I'm lucky.
Yeah.
I've been in Turkey and Istanbul and in other parts of Turkey, and I love the interaction. I think the people is friendly, have a very nice level of communication. Uh, the majority of the colleagues have a hunger for learn and improve. And KLIVET is, I think every time that I've been in a KLIVET Congress, I see the same. People really paying attention. How can I improve my professional practice? And I keep seeing the same. It's a beautiful place. The venues are gorgeous. I mean, check it out what is out there. And you can see the Istanbul city, and it's like, I can watch that for hours and hours and hours. So I really love KLIVET Congresses.
Congress.
They're a wonderful congress.
Dr. Tello, thank you for coming. The
Thank you
Animal
for having
Congress.
me. I mean,
Thank you
anytime.
very much.
Thank you so much.
Thank you so much. Yes.